Antihistamines. What is histamines? Histamines is an important chemical that has a role in a number of different bodily processes. Histamines stimulate gastric acid secretions, plays a role in inflammation, dilates blood vessels, affects muscle contractions in the intestines and lungs, and affects your heart rate. Histamines also helps transmit messages between nerve cells and helps fluids move through blood vessel walls. Histamines is also released if your body encounters a threat from an allergen. Histamine causes vessels to swell and dilate, leading to allergic symptoms. Anti means against, so antihistamines are medicines that work against or block histamines. Antihistamines are a class of drugs commonly used to treat conditions caused by too much histamine, a chemical created by your body's immune system. Antihistamines are divided into two major subtypes. 1. The first subtype is called H1 receptor antagonists or H1 blockers. This subtype of antihistamines is used to treat allergy symptoms. 2. The second subtype is called H2 receptor antagonists or H2 blockers. They are used to treat gastrointestinal conditions, including gastroesophageal reflux disease, GERD, peptic ulcers, gastritis, motion sickness, nausea, and vomiting. The naming structure, Act 1 and Act 2, tell doctors and scientists the cell type, the location of the histamine receptors, thus the antihistamine medication blocks. The Act 1 blocker subtype is further broken down into two groups: first-generation antihistamines and second-generation antihistamines. A. The first-generation antihistamines, they work on histamine receptor in the brain and spinal cord along with other types of receptors. Most notable about this generation is that they cross the blood-brain barrier, which results in drowsiness. B. Second-generation antihistamines. They do not cross the blood-brain barrier to the extent the first generation do, and therefore do not cause drowsiness at standard dosage levels. Second-generation antihistamines are considered to be safer than first-generation antihistamines because they don't cause drowsiness and interact with fewer drugs. A few examples of first-generation over-the-counter and prescription H1 blockers include brompheniramines, chlorpheniramines, lemactin, cyroheptadine, dechlorpheniramines, dimenhydrinase, diphenhyramines, doxylamines, hyproxyzine, phenidamines. A few examples of second-chain operations over-the-counter encryption icon blocker include azolatin, loratadine, cetirizine, decloratadine, fexofenadine. A few examples of actual antihistamines include cimetidine, famotidine, desatidine, ranitidine. Some side effects of antihistamines: sleepiness, drowsiness, and reduced coordination, dry mouth, blurred vision, difficulty peeing. Antihistamines can pass into rest meal, so you should consult with your healthcare provider before using antihistamines if you are breastfeeding. Children and the elderly are more sensitive to the effects of antihistamines, so special consideration will be given to the use of these products in these patients. Never give over-the-counter cough and cold antihistamines to children under 4 years of age. These medications can cause life-threatening side effects. Keep in mind, always check with your healthcare provider and your pharmacist if you have concerns about antihistamines, and always follow the directions on the labels. Thank you very much.